All right, my name's Dr. Clifford Porter. In support of HB 1959, I'm the Senior Fellow for Healthcare at Texas Public Policy Foundation, who I'm representing, and myself. I'm a local practicing physician with a direct primary care clinic. I'm sort of at the other end of what Representative Frank is trying to do with his business. I actually treated patients like his, not yours directly. What this does in an important way is actually help more competition, because I see this trying to actually give my patients various procedures, and they see those types of costs in front of them that affect their deductibles and so forth. So by allowing them options, they can actually save a significant amount of money. I see this a lot in the self-funded market, and it should be brought to other areas as well, particularly when I say procedures, surgeries, referrals to specialists, and so forth. So since the self-funded employment plan systems already have this, it just makes sense to extend it to other ERS and TRS type employees. And I actually have ERS and TRS beneficiaries who pay extra for our services just because they're so frustrated with the corporate, large bureaucratic systems. So now the restrictive behavior that's currently going on, often called tying or exclusive agreements that go by a variety of different terms, they're essentially limit options, and they're essentially monopolistic in many ways. And when you have monopolistic behavior, whether it's only one or two insurers, one or two hospital systems, it just simply drives up costs, and the employers and the patients end up paying those bills. From the fiduciary question on it, this actually I think is a very important part, because this is actually occurring in the pharmacy benefit managers system. So there's actually employees bringing civil litigation against their employers for being failed fiduciaries for their pharmacy drug plans. So ironically, Pfizer and Mayo Clinic are being sued by their own employees for being failed fiduciaries on these plans. See, my time's coming up here. So, there's an argument that this might increase costs by, steering in different ways and limiting options. It actually does quite the reverse. The arguments that this increases costs are just showing that the tying and exclusivity type agreements are in fact efforts to actually monopolize the market. So with that, I'll take other questions.
Okay, we appreciate your testimony.